anatomy?
They learn the conventional anatomy on atlas, books, and all this stuff. So they have some seminars in radiology in which they try to understand the technology, which is on which they.
But this is just for the specific.
Yes, yes. Now, when you finish with your studies and you want to start to learn some specific specialization like radiology or surgery or radiation oncology, whatever, then you have to start again and again to learn how to interpret. Normally, I mean, seeing lungs is very easy. Even you can see that and you can recognize it as a lung. But once we have the smaller structures, once we have not normal anatomy, it's getting a bit difficult. He knows what it is. Okay, let's see the scan process.
This is from the body.
Yes. Yeah. No, the problem is, if I show you how the picture is, you see it here? So you make a kind of overall picture to define what part of the body you want to scan. So you, as I said, you can scan all the body, but we don't do that so much. You can scan just one part, so he's defining and say, okay, I take from here to there, head. Let's say head and neck region. Now you see that the machine will start to move slowly. So this is the other perspective. You should be aware that once you get the information into your computer, you can represent images from any possible perspective you want. You can have it like this, you can have it like this, you can have it it's absolutely free to you. I mean, that is the main advantage of digital imagery. You're not fixed on a two-dimensional limitation of a normal picture. You know, once you have a normal picture like this, you have just one this possibility. You have this one this perspective. That's it.
Traditional.
Yeah.
The simple version.
That is the analog. Let's call it analog photography. Let's say, which gives you the possibility of two dimensions to see, to look at the picture. That's it. Either you know what it is or not. That's it. But this is the difference. You see, the machine is, the patient is going through the gate. The machine is just, walking around him on the 5 seconds or 6 seconds. So it shows you again, this is the brain. Now we go down. Some eyes, nose, small brain. That's the nose, that's his mouth. Now we are in the neck region. So very easy, as you see, just 5 seconds to scan this region. And this machine is not the fastest. You have even more faster machines which are just 2 seconds.
2 seconds.
You need, let's say, 5 seconds from there to here. Very, very fast. Yeah, that's the advantage of when technology is advancing, hardware and software. Even our practice is changing. Once you needed, let's say, 10 minutes. It was a long time. Now you need just 5 seconds. And, so, as you see, you can have a lot of perspectives. You can see that from the side. You can see that from beneath. You can see that from front. So, and he is playing for us all possibilities. And you can even see the skin. That's the reconstruction of skin. That's what analog photography is. It was never.
Is it possible to analyze the skin?
Yeah. You see the mask, which is on the head. And if you didn't have the mask, this part, for example, that's the skin. That means the machine is reconstructing for you any possible visible structure of the body, from skin to the deep. And you can play with them. So that's the advantage of 3D. You can play with them. You can see the bones. It's perfect for presentation.
Professional.
Yeah, I didn't prepare. I don't know.
There's various functions.
Yeah, you have a lot of very big variability of functions. How you...
It's very simple interface.
Actually, yeah. You see, you can even depict even the table on which the patient is lying. You know, you can depict the
Inside of-
table, inside. Theoretically, you can go even inside the table if you want, but we are not very interested in the table, but in the inside the body. So you see how beautiful it is looking? This is actually better than painting, actually.
But it is possible to color skin.
If you want, yes, you can. But so we are not really very focused on color and all this stuff because normally when you have a kind of a gray scale, which it is, you know, from the very bright gray to a darker gray, which makes something for you easier. We have a lot of imaging procedures like positron emission photography of PET, which show you a lot of different colors. But color doesn't mean always something good.
Yeah.
There's not always a surplus of knowledge. Sometimes it's just disturbing. So I guess for CT, these gray scales you have, you know, you have a very bright one, gray shadowing, darker, and very dark. So that's for our purposes is absolutely okay. I mean, interesting is just to know this database gives you the possibility to represent on screen what you need. No, we use it. That's absolutely.